Today I will be talking about a diffusion tensor imaging study on the white matter skeleton in individuals with sports-related concussions. For the introduction, cerebral concussion is the most common type of traumatic brain injury. Centers for Disease Control and Prevention estimated that about 30,000 sports-related concussions occur annually in the United States. There is evidence of increased risk for developing mild cognitive impairment such as Alzheimer's disease, depression, and suicidality, especially in football players who have sustained repetitive injuries earlier in life. There are also significant differences in brain activation patterns in individuals with traumatic brain injuries, and persistent symptoms have also been shown in functional MRI studies. There is also evidence that has recently been suggested that these abnormal brain activation patterns will persist for months after injury. For the methods that they use 10 college students who sustained a concussion, 5 women, 5 male, and 9 of which who were sports-related concussions. The one other one was a woman who had fallen on her head on a sidewalk. And all of these athletes were diagnosed with minor traumatic brain injury. They were all given an MRI scan, and a diffusion imaging analysis was carried out using tract-based spatial statistics. This is an analysis of the white matter skeletons, and this suggests an absence of structural integrity located in the left temporal lobe, where association and projector fibers go through anterior, posterior, and superior, inferior, and where they merge and cross. So the discussion for this is there has been a suggestion that a similarity of the manifestation of military blast injuries and repetitive sports-related concussions with persistent symptoms, or identifying a region of the brain that is particularly susceptible to mild head trauma. This brain region may be more susceptible to injury from the rotational and forces that are acting in the sports-related concussions, and this could also prove to be a diagnostic tool to help determine the severity of the injury and decide whether or not the athlete should be allowed to return to play-by-play action. Thank you.